on in, come on in. Y'all want to stand back there?
Yeah.
All right, this is a small space, but thank you all for being here. Get back here. So we are the Michigan Clinicians for Climate Action. We represent about 450 Michigan health professionals who view decarbonization and electrification as a health solution in addition to a climate solution. So there's about 15, 20 clinicians here in Lansing today. We're meeting with various lawmakers, both in the House and Senate, talking about protecting the 2023 clean energy laws. We see that the need to decarbonize, both because it's becoming increasingly affordable to do so, but because it can address the immediate health impacts of fossil fuel pollution in a local sense, and also the long-term climate health impacts. So thank you all for being here. Here are some of our physicians and nurses who are joining us today. And in addition to protecting our 2023 clean energy laws, we're also supporting other solutions that can advance decarbonization in an equitable way. So I want to start by giving the floor to Rep. Matt Longcon. Thank you so much.
Thank you. And I'm not sure when you said go live, if I'm going live to camera, where we're going. But so glad to be a part of this group of clinicians who not just have their heart in the right place, but are following the science. It seems like every week now that we have a once per 100-year storm. The effects of climate change are felt in our communities, and as the only medical doctor in the legislature, and as someone who's worked with Dr. Gabuono to educate medical students at the institutions where I've taught about social drivers of health and how climate and environment honestly often load the gun, even if behaviors pull the trigger. The risk of lung cancer, for example, if you live within a half a mile of a highway, the relative risk is equivalent to living with a smoker compared to not living with a smoker. So, we have a lot of work to do to put patients and people of Michigan ahead of profits and other things that we have to deal with in healthcare all the time. But this is something that I know clinicians across Michigan are engaged in, trying to get upstream and prevent illness and injury wherever possible. As a prevention medicine guy, I know that you can pay now or pay later for these things, and we have to invest in climate solutions now to avoid the downstream effects. Asthma and allergies and so many other things that lead to costs in our healthcare system that are preventable start with climate action. So pleased to be a part of this group, and really thank you all for coming to Lansing and making your voices heard today.
And we're going to pass it over to Mia McPherson. Hello, thank you all for being here, and thank you for that great introduction, Representative. My name is Mia McPherson. I'm a registered nurse from Southeast Michigan, and I'm also here on behalf of the Alliance of Nurses for Healthy Environments. I work in adult oncology, so I feel that it's very important for me to be here today, talk about how we can prevent cancers, particularly through clean energy.
And my name's Matt Masana. I'm an internal medicine physician and hospitalist. I currently work for Trinity Health right now. I've been a MiCCA member for about over a year, and I just feel that these discussions about renewable and clean energy is important, not just from a global health and climate perspective, but also from some of the immediate effects that we see in our communities here in Michigan. Like I said, I work primarily in a hospital setting, so a lot of the work I do sees patients who come into the hospital with exacerbations of chronic illness, and patients who have chronic diseases like lung disease, heart disease, dementia. And what we are seeing is that the air quality and some of the changes in heat and temperature are driving these hospitalizations to a certain extent, both from kind of the immediate impact on health from lung impacts from air pollution, but I think also from a perspective of when the grid is not reliable, especially in Michigan, this has been a specific issue here where our grid reliability is struggling. We need ways to help strengthen and improve that grid while getting away from some of these fossil fuels that are causing damage. When our power goes out, that's patients who don't have access to their oxygen. They don't have access to refrigeration for their medications. They don't have the ability to heat their homes or cool their homes in different seasons, and when that drives people into the hospital, everybody pays. Everybody pays for these things, and our patients especially, but I think as a community, our healthcare prices are astronomically high and only rising. So I think that there's multiple reasons why we as a Michigan community should be looking into avoiding fossil fuels, investing in other sustainable, reliable, clean energy for our grid to help both keep our community safer, but also to help make sure that we have a more sustainable energy future for Michigan.
I'm Alex Rabin. I'm a pulmonary and critical care physician at the VA Ann Arbor and at University of Michigan. And as a lung doctor who cares for patients with breathing problems, I see firsthand the impact that bad air has on our health and on our patients' health. And over the last few years, especially as wildfire smoke has affected patients in Michigan, I've had countless folks come to my office suffering from difficulty breathing, coughing, sputtering. Patients have called our nurses line asking for help, especially in the summer months. And when they come into clinic, often I just send them straight to the emergency room where they get admitted. But it's not just our sick elderly patients. Neighbors whose kids have asthma have had to keep their kids cooped up in the summer months, missing school events, missing sports. And some of my colleagues in pulmonary medicine, those who've worked in Michigan their whole careers, decades, have said that really the air quality events we've seen over the last few years have been different from anything they've ever experienced in their careers. So what does all these wildfire smoke events, what do they have to do with clean energy policy? Well, it's obviously just one example of how the effects of that air pollution and soot have on our health. And of course, at the root of this is fossil fuel combustion, which drives climate and extreme weather that's making our patients sicker. And what I see in my patients is, it's not really just anecdotal, it's borne out in the numbers, as you mentioned, Rep. Michigan's air is actually among the dirtiest in the country. In 2021, researchers have found that Michigan had the third highest rate of death from soot pollution in the United States, causing 177 premature deaths per 100,000 residents. So to protect our communities, particularly those who live closest to power plants and roadways, and even those who don't even realize the air that they're breathing is harmful, we need to act urgently to address the sources of pollution that are poisoning our lungs, driving up healthcare costs, and jeopardizing our kids' future. And the good news, of course, is that we have a lot of the cost-effective solutions right at our fingertips with the revolution of solar, wind, and battery storage. And as we say in Ann Arbor, we want Michigan to be the leaders and the best. And I'm proud to stand here as a physician in support of clean energy.
I'm Deborah Hendrickson. I'm a pediatrician and professor of pediatrics at the University of Nevada School of Medicine in Reno, Nevada. I'm also the author of a book called The Air They Breathe, which is about the impacts of air pollution and climate change on children. And I've been here in Michigan all week touring with MiCCA, talking about how these issues affect the youngest and most vulnerable members of our population, which are children, especially under 5 years old, who are the most profoundly affected by air pollution. And that's for three major reasons. One is that they're smaller, of course, so that they get a bigger dose of air pollution per pound of weight. They have a different physiology. We often say in pediatrics that children are not just small adults. And we mean by that their bodies work differently in ways that make them more susceptible to environmental harm. And third, and perhaps most important, is that their organs are still developing and growing and are very susceptible to being, that process can be derailed or altered by exposure to certain environmental hazards. And I want to just highlight two especially important fields of research that have been done on this, and that's how air pollution affects the lungs and brains of growing children. So 80 to 85% of lung growth happens after birth, and most brain growth, of course, is also early in life. And we know that children who are chronically exposed to lung pollution, like in high pollution neighborhoods of urban areas along busy traffic roads, that those kids are more likely to have smaller, stiffer lungs, that they really have, it stunts their lung growth. Kids those same kids we know have higher rates of neurodevelopmental injuries that actually alters brain development in ways that can have profound effects on their later health and ability to obtain jobs, function in society. So, especially the injuries, especially profound in the prefrontal cortex of the brain, so which is where executive functioning and thinking are. And we know that when you do cognitive tests of kids who are born in high pollution areas versus clean air, you can see significant differences in the ability of those kids to think and plan and do well in school. So these obviously have lifelong implications for children. But we also know that there are immediate benefits to cleaning up the air they're breathing. When you take one landmark study showed that when you take children from a high pollution neighborhood and move them into clean air during the adolescent years when there's a lot of rapid lung growth, those kids can recover 10 to 12% of their lung capacity just by moving to clean air. So if we cleaned up the air, you'd see that benefit. But also, of course, when you stop polluting the air, the kids are immediately not being harmed further. So anything you can preserve of their development, of their non-development is worthwhile. And so, for all these reasons, cleaning up the air is a justice issue for children. It's, we want to, we don't want to profit certain companies now at the expense of their health, and it's also an issue for society. So, and I've seen kids, as you're talking about, we've had a lot of terrible air, and we know because we're just east of California and all the wildfires there. I told the story in my book of multiple of these children, but like one 4-year-old boy, tired of being housebound, ran outside on a smoky day because his mom was trying to keep him inside. Within a short time, he was wheezing, coughing, and ended up being hospitalized for several days, just from trying to play outside. Clean energy, these are the reasons, both the immediate effects of fossil fuels on kids, from traffic pollution, power plants, and then the secondary effects from wildfire smoke, which is increasing because of our use of fossil fuels. These are the reasons to switch off those dirty fuels and to support clean energy.
Donovan McKinney, currently serve as a state representative in the 11th House District, that is Northeast Detroit, south side of Warren. If you know anything about Eminem and the 8 Mile movie, that's my district. So I got both sides of 8 Mile, representing Eminem's old trailer park, and as well as where he grew up at on Dresden Street on the northeast side. But I grew up in the city, was diagnosed with asthma. My brother and I were diagnosed with asthma at a very young age. I was diagnosed at 7 years old. Grew up near, Mound and 8 Mile, near the old Mound engine plant, the Chrysler engine plant. And, we grew up next to smokestacks. And so we didn't know any better, but, we had very impacted by our lungs and just the dirty air. Now my wife and I, we have 3 beautiful children we're raising right now in the same neighborhoods I grew up in. Wow. And we have a 4-year-old son. He recently turned 4 in January. A 2-year-old middle son. He turned 2 on Valentine's Day. And the baby girl, I like to say, who runs everything, recently just turned 9 months old. Mm-hmm. And my 4-year-old was just diagnosed with pre-asthma at 3. My 2-year-old is on the same trajectory. And I don't know what's going to happen with our 9-month-old baby girl, but she's probably on the same track. There's stats that says zip codes that I represent, zip codes in the Metro Detroit area, that says by the time your child at the age of 5, they have anywhere between a 2/3 and 70% chance of developing asthma by the time they hit 5. And so we have some of the most polluted zip codes, not only in the state, but in the country. There was some, I think last term, I don't think you were elected yet, but because of the Canadian wildfires that came, they blamed it on the Canadian wildfires, right? The smoke that traveled from Canada this way. But we had some of the worst air quality in the world. There were days, I think it was like 9 days or 10 days or something consecutively, that we had the worst air quality in the world, y'all. Like, what are we doing? And so myself and State Senator Stephanie Chang, we've been leading these past 2 terms the POCA legislation, which is Protecting Overburdened Communities Act, really looking at our air quality because we have so many parts and suppliers and businesses in our district that pollute our air. And in reality, we need to give Eagle the tools possible to either prevent greenlining certain permits, because it seems like they just do it every time a corporation wants it. We're working on the polluter pay legislation, also introduced the Green Amendment alongside State Senator Sue Schenck to make sure we have a constitutional amendment in Michigan's Constitution for our environmental justice advocates, and more importantly, the rights of us to be able to breathe clean air and drink clean water. Another thing that we had a press conference on recently, we finally got the bills back from the Legislative Service Bureau. Shout out to LSB for holding up the legislation. But we're dropping the legislation either today or tomorrow. We're collecting co-sponsorships with the most progressive community solar legislation in the country. And so I'm so excited about that. But these are the things we have to do. And I got to give my grievances to the House Republicans here in Michigan. The way they tried to roll back our Clean Energy and Jobs Act that we passed last term, I've been quoted saying that it's asinine. I think it moves our state in the wrong direction instead of moving us forward. And we have to call them out every step of the way. And we have to understand that the Michigan Public Service Commission hasn't even been able to approve a clean energy project yet. And they always want to roll it back before it actually comes into fruition, and let it work and lower the cost of rates for families who are struggling to make ends meet day to day. So it's a win-win solution for our public health, for people's pocketbooks, and more importantly, we as a state need to continue to lead in clean energy. And I'm just so excited to be here amongst the clinicians and people in healthcare, our healthcare professionals, and the only medical doctor in the state legislature. So thank you so much, guys, for your time. Yeah.
Before we turn it over to questions, I will have Mia close us out.
Great. So I have some very great advocates at this table with me, so I decided to keep it very brief. But I do like to say that nurses, we are carriers of stories.
Yeah.
So when I'm at a patient's bedside and I'm talking with them or their family, their loved ones, they do have time to reflect and process on their diagnosis and where they are in their journey, their cancer journeys. And sometimes they say things like, I wonder if I was exposed because of where I live next to X. So sometimes, as the representative has said, smokestacks, living near manufacturing plants, or just industries that are very heavily reliant upon fossil fuels. I also have patients that say, I did everything right. You know, I exercise, I have a healthy diet, I don't smoke, I don't drink. How did I end up with cancer? So there's many drivers of cancer, genetics and lifestyle choices, but also there's that environmental factor. And we have to always bring that to the forefront of the discussion about not just cancer, but other acute and long-term health conditions. We can't ignore that. I think that there's a certain industry and maybe some of their stakeholders that would like for us to ignore the impact that fossil fuels have on our economies, that it has on our health, both on an individual and a population level. And I don't think that we can afford to let that voice be louder than ours. So again, I just want to thank everyone for being here today, especially both the representatives, but also our clinicians. I can only speak for myself, but I'm very busy day-to-day life in clinic, so I don't want it to be lost on the fact that we were able to make the time today to kind of talk about this. It must be really important, and you know, we don't want to just continue the cycle of treating certain illnesses and diseases. We would like to prevent them. So thank you all again.
Thank you. So before I turn it over to any questions, I did want to bring up that, as Dr. Hendrickson alluded to, we've been touring with her, promoting her book, which does a beautiful job explaining many of the impacts that have been discussed. But a pediatrician who attended raised the question that if we asked ourselves, you know, what is best for our children when making any decision, that we would all make better decisions. And so that's also part of today's purpose in having clinicians show up, is meeting with lawmakers and saying, what is best for our children? and really think about that and answer that question. So thank you all for being here. Any questions from y'all?
Yeah, I got one. Kyle Malin from MERS. So outside of blocking the Senate bills that basically turn the clock back on the 223 laws, is there anything else that you'd like to see kind of on your front burner that the legislature can pass to, limit the amount of pollution that's allowed in the air?
Yeah, no, good question, Kyle, and I would like my colleague to address it too. But everything I mentioned earlier in my remarks, our Green Amendment legislation, we need 2/3 of the vote in both chambers. I think it should be bipartisan, but having a constitutional amendment to go to the voters of the people. It won't automatically go in there without a vote to the people. So we're asking for it to be on this November's ballot. We got to get it done by July or so, I believe, if that's going to happen. But give the people the right to have the decision to put this in our state constitution, to strengthen the laws that are already on the books, to limit as much pollution as possible. I'll say this too. There's a stat that just came out. I was reading an article recently, I think about 2 weeks ago. By the time your child at the age of 2 years old, they have a 90% plus chance of having PFAS in their blood. Like, just think about it. Forever chemicals. You cannot get rid of them. Cannot mitigate them, cannot remediate them. But we can figure out ways to make sure that number goes back. And so this is about not only our children, this is about our health, everybody in our communities. But we need to pass the Green Amendment, our community solar legislation, our Protecting Overburdened Communities Act. There's so many things that are already, in the queue that we can pass. We just need a legislature that's having the courage and willingness to do so.
Piggybacking on Representative Kenny's comments is easy because he's such a great leader in this space. The truth is, in addition to the list of priorities that we need to work to advance, often in the State House these days, we're playing defense against things that are happening at the federal level. The rollback of EPA thresholds on PFAS and other things like that. You got federal administrators who are talking about, on the one hand, making it harder for folks to get immunized and believing junk science with, poor study design and international data that have no relevance to the United States. And then on the other hand, believe one study from industry that says that we should roll back, PFAS or other thresholds. So there's no consistency or theory in the federal action. And in addition to being able to just follow on the coattails of my friend here in state, I'm also anxious to see you in D.C. do some things to prevent that happening in the first place. I'm a preventionist. So I think we've got a lot to work on, as Rep. McKinney gave a whole good list, but we also have to keep our eyes on what's happening with federal regulations and make sure the clinical voices that are in this room are lifted up. Dr. Henrikson's book and other perspectives are so important to bring to this, because parents and clinicians and folks who are on the front lines of taking care of kids and families and older adults who are prone to medical risks from poor climate exposures, they all know what they want us to be doing in the legislature, which is putting people first. And that's our job.
Any other questions?
I have a question for the reps. One of the hot button issues right now, of course, you referenced federal rulemaking, is keeping coal-fired power plants open beyond their expiration date. Of course, J.H. Campbell Generating Station has been kept open for kind of unclear reasons. Is there anything that the State House can do to try and
I'll jump in on this one first. I was going to mention following in Rep. McKinney's footsteps and co-sponsoring all the great stuff he's been doing, but the other thing that we need to recognize is the tip of the spear on that action here in Michigan is through our Attorney General's office, what she's been doing to file suit. And, these corporations don't want that coal plant open either, right? There's no reason for it to be there except for an agenda that is anti-climate science, right? Like it's putting a thumb in the eye of people who live in and around the community that's going to be exposed to that coal plant's exhaust. but all of us have to play our role in supporting, lifting up our voices, encouraging the Attorney General to continue that action. Right now, the hand's in the courts, not our branch of the government.
And outside of legislation, we have to educate them. Like, not only the voters in our community, but even elected officials themselves. I've had a group of farmers that came up here last month complaining. They're hurting. Their pocketbooks are hurting, for one. But two, they can't even grow crops or food right now in rural Michigan because of the change in weather.
Yeah.
There's no consistency in our weather. Yeah. And so I asked them the tough question. I said, do you guys finally believe in climate change?
Good for you.
And a lot of them, they laughed, but they're like, yeah, actually, I do now.
Yeah.
And I asked my Republican colleagues in the same meeting, do you guys finally believe it? They wouldn't admit it in that meeting. And they probably would never admit it publicly. But we need to stop taking these hard stances and look at the science and the numbers. Everybody's getting impacted by all of this toxic air and water and waste. And so we need to figure out ways to remediate it ASAP through legislation, but through education. And that's where you guys come in as health professionals. I just appreciate you.
We appreciate you, and please feel free to reach out to us anytime that you think that helps voices, and we'll do our best to mobilize. As Mia said, these people who are practicing are really, really busy, and it's hard for them to be here, but they will for this issue because it's that big and that important. So huge thank you for your leadership.
Thank you.
Any other questions? Not? All right. But there's a lot of experts in the room, so please talk to them. We'll be here. All right. Thank you so much.
Thank you guys. Appreciate it.